Hello, my name is Shazeida.
And I'm Patrick, and this is our baby, Erin Fia.
I'm here to talk to you a little bit about our breastfeeding journey. Erin was initially given just sole breast milk, and I really struggled in the first couple of days in terms of knowing how much colostrum, which is the thick milk that's produced once the baby's born or just before the baby's born, and knowing how much I was giving her. That was an initial kind of onset worry for me, but I continued to persevere and started providing her this colostrum as often as I could and as often as she would take. One of the things that happens during that time is that you don't know how much you're giving or how much is enough. I did really kind of struggle, and I had some anxieties around whether she was given enough. I made a decision to breastfeed solely prior to giving birth, and I did feel some pressure to kind of maybe think about formula just because I didn't know what she was getting, and that became a more compounding when Erin had to be taken into hospital because she had a difficult night where she didn't want to get up for any feeds through the night, and she wasn't drinking any of the breast milk that I was offering. It happened to coincide at a time when my breast milk was just coming in, and I think for me it was on the 4th day or the 3rd day, and I felt like it couldn't wait, and I felt really worried for her because she was very small as well. And we did decide to take her to the hospital and where she was seen. And one of the things that was picked up as part of that assessment was that she had lost, I think, 9% of her body weight, which of course is a worry to lots of parents because you want your baby to be growing efficiently. I felt really conflicted at the time when I was at the hospital because I met with the doctor, and one of the things that they were talking about was formula feeding, and Patrick and I, we both had kind of this intention of giving sole breast milk, but when we're looking at weight loss, a parent, you have conflicted feelings. I mean, I think maybe this is a good time for you to come in because we had a difference in opinion in terms of what needs to be done at that time. And for me, it was really important that I tried to continue breastfeeding, but for you, you felt worried about her losing further weight, and we did not want that either. Should we talk? Do you want to say a little bit about that part?
Yeah, so there was that sort of period of time where milk was coming in and she was losing weight, and we just weren't sure whether she was getting enough really. And I guess in a way, after the doctor's advised we top up with a bit of formula, of course you can be inclined to just want to give solely formula or shift mostly to that and top up with breast milk. But actually we were able to sort of just pause, weren't we, and just zoom out and think about the bigger picture, which is the information that the doctors have given us, that yes, there is often a bit of weight loss, and that it is often the case that can take between, I think they said between day, was it 2 and 6 or 4 and 6, where the milk's coming in and it might be a bit of a struggle, but if you can get through that period, that you will see an improvement. And so we kind of just held our nerve a little bit, and we
did formula feed, didn't we, in the sense that we were what they suggested was a feeding plan for Erin, and obviously for everyone it's going to be different dependent on what people's individual journeys are. But for Erin, they recommended a 20 ml top up every 3 hours in addition to kind of breast milk being offered to her. And so we started that. One of the things that was important in that period was that my feelings towards breastfeeding and what I wanted moving forward. The way we were able to bridge the gap between the fact that I wanted to sole breastfeed was, for us, we ended up purchasing an a breast milk, what are they called? I've forgotten the name.
What, pump?
A breast pump. We invested in a breast pump, and I was able to express milk and then build up the however many millilitres they suggested over the course of the day. So we were giving her that over time, and now she's mostly breastfed again, and so that's kind of what worked for us in terms of.
But there were moments, obviously, where we felt quite anxious, and you were struggling with being able to sort of go through the process, and whether you weren't sure, were you, whether you were getting or giving enough. And I think the expressing was really helpful, because then you can actually see what you're putting into the baby. That helped both of us, because I became involved with the feeding a bit more, and so I could see that there was 60 ml of milk, breast milk going in the evening, or 20 or whatever it was,
so it's not that much.
which was really helpful. But also just knowing that you don't need to make a decision in the moment. You don't need, in a moment of panic or worry, to make a decision about how the rest of the feeding will go throughout their development. You can just pause, step back, know that actually this is just a moment, that it won't last forever, and that actually you can take a more informed decision when you speak to your midwife about what to do next. And sometimes just keep persevering, and there was a bit of motivation, and I was trying to make sure you were eating the right foods and giving you encouragement and telling you can do it, that actually we know that nothing is going to change in the next 24 hours, the baby's still feeding. So it's just sort of being calm in the moment, and also just thinking about, is this a moment where we need to do something practically different, like expressing milk, or is this a moment where you just need me to listen to you and just support you and encourage you to just be, the good mum that you are? And I think if you can sort of just be calm in those moments and not jump to a rash decision, I found that helpful for both. I think you found that helpful. It's just a good
and I think it's a time where, for me, I wasn't expecting to feel such intense emotions, and it can feel really overwhelming at times. And to make a decision to breastfeed your child takes a lot of physical and emotional strength, and it's time consuming and it's taxing on your body, in addition to sleepless nights anyway because of a newborn baby and all the other pressures that come along with becoming either new parents or having a young baby. There's just quite a number of things we're trying to adjust to.
But in the beginning, when it was difficult, I think we definitely, we had our moments, and we had our differences, or we might have had a little argument about something, and you're not really sure how you're going to get past that moment. But then within a few days, you realise that the best approach is just to, as a dad, I think it was helpful. I noticed the difference when I just started listening to how you were feeling and being like, okay, that's fine, and not just trying to respond or fix it, but just listening. And then afterwards, when things were sort of a bit more chilled, we were able to then make a better decision. Because if you're trying to make a decision in the moment when you're stressing out, it's going to probably be the wrong decision, and someone's going to feel resentful. So it was just a matter of just stepping back from that moment of, and it comes from anxiety, it's not from anything else. But if you can just pause in that moment, take a deep breath, step back, and then think about it. And if you can't come to a decision together, I think we found it helpful just speaking to a midwife or a doctor, just to say, well, these are the kind of things that we're worried about, these are the things that we're not sure about, this is where we disagree, and they can help you sort of work through that. And that was helpful.
Yeah, some of the things that I found helpful, and I'm obviously very early on in my journey in terms of breastfeeding, and it's yet one that remains to be seen. Some of the things that I did find helpful was, I've been reading a book, and there's loads of books about breastfeeding and what the first few weeks look like. And I found that helpful just because when I was feeling, for example, intense emotions, or I'm feeling extremely tired, or I'm feeling my body feels weak because I'm trying to express so much or give spent so many hours trying to feed Erin. I found that really helpful. And another thing that I found really helpful once I was going through this difficult period of having to introduce or feeling the need to introduce formula feeding was I went on the internet and a friend told me about this group, and there are lots of different groups that kind of run. I went to it's a once a month type of meeting called a lecture, and I found that really helpful. It's a support group for mums that are breastfeeding. And I found that really helpful because there's a community, and I was able to share some of the feelings that I had, because it can make you feel like, well, whether you feel validated as a mum in terms of that journey. And so I found that really helpful, and I'm sure there's lots of other things, and speaking to my midwife has been really helpful in terms of reassuring me that I'm not on the wrong track, and that things are, it's okay to be positive, and that I can continue with support.
And if I was going to say one thing to dads, just be patient. And like, I didn't realise that Erin would be on mum's breast for so long, and it takes ages. She's there sometimes for like 40, 50 minutes, and I didn't know it'd be that long, and I've learned that it's that long now.
Yeah.
If you build that into your day, and that's how long it's going to be, and you can take some time out, like I might use that time just to relax, or to ask you if there's anything you want afterwards, prepare some food, so that you I was giving Shazeida a bit more space, rather than being like, oh, she finished feeding yet? And like, she might have finished for a bit, but then she starts again, and just
within 10 minutes.
Yeah.
Sometimes.
So being patient as a dad, just being patient, because you can't do anything. You just have to sit with the idea that you, in that moment, you're not going to be able to help that much. You can do little things, but just sort of stepping back and giving mum and Erin the space just to get their feed done. And it might take an hour, and that's all right.
I think routines do kind of go out the window when you're breastfeeding, and that's okay. But what we're finding is actually over time you do find new routines, and I think those routines probably likely to change for us again. But you do build up new routines eventually. But that's been. Is there anything else we'd like to say about it?
Just be calm, be patient, don't be reactive. Wait for the right moment to have the conversations about big decisions, and just I think, trust your instincts as well. I think.
And I think for moms, just like believing in yourself, and if you're having a day where you feel like you're not having as much milk maybe as you wanted to, or you're not having an off day, it's okay, and your baby will be okay for that one day, and you just keep on going the next day. And I think that's been helpful for me.
I think that's probably it.
I think so.
Good luck.